Hello, I'm Virginia Wotring, and thank you for joining me to hear about space pharmacology. I'm delighted to be here at the Australian Space Biology and Health Symposium, talking about one of my favorite things, which is pharmacology, or pharmacokinetics and pharmacodynamics in space. So these are things we don't talk about much. Pharmacology is the study of how drugs act in the body and on the body, and it is really dependent on physiology. And we know that physiology can change in space. You're hearing a bunch of other talks in this symposium about exactly that. So we think that, that pharmacology could be affected in spaceflight. We're still working on collecting the data, though. The study of pharmacology can be divided into pharmacokinetics and pharmacodynamics. Pharmacokinetics is how the body acts on the drug. So when the drug is absorbed into the body and transported throughout the body and distributed to tissues and then degraded or eliminated. These concepts are known by the acronym ADME, or absorption, distribution, metabolism, and excretion. The other aspect of pharmacology is pharmacodynamics, and it's the study of how drugs act on the body and interact with the tissue cells and molecules that are the targets. So are pharmacokinetics affected by the space environment, which is very complex, as you know, and includes exposure to ionizing radiation or constant noise or lots of sunrises and sunsets, high CO2, living in a stressed environment. There's a whole list of possible environmental changes in space, in addition to microgravity. I started exploring pharmacokinetics in spaceflight with an intern, Johannes Kast, who came to me from the University of Florida. He was working as PhD at the time. He interned with us at Baylor College of Medicine through a National Space Biomedical Research Institute internship and did some modeling. He had been a pharmacist before he went to graduate school, so he was keenly aware of the dosing requirements for ordinary terrestrial drugs. And he wondered if those dosing requirements would need to be different in space. So we did some modeling to explore this. So the biggest concern about pharmaceutical use in spaceflight is that we're operating now under an assumption. The actions of pharmaceuticals on physiology altered by the spaceflight environment are currently assumed to be the same as the actions during terrestrial use. But this has not yet been established on the basis of evidence. We have reason to believe, because of the kinds of physiological changes that have been shown and the degree of those changes, we have reason to believe that there might be some pharmacological issues. So in pharmacokinetics, we like to do a lot of things with a pharmacokinetic curve, a concentration versus time plot, where at various time points after administering a drug, we take a blood sample and measure the plasma concentration. There'll be a rising phase where after dosing, the concentration in the blood goes up and up and up and up. And after a little bit of time passes, metabolism and excretion will begin to occur, and the concentration of the drug in the blood will then drop. We can measure these rates. We can model absorption and distribution on the rising phase and metabolism and excretion on the falling phase. This kind of thing has been done for decades. It's standard with every drug that goes through drug approval systems. We can use this kind of a way to do a study, a mechanism to do a study, and think about what could change in spaceflight. Because we can model these curves on the basis of terrestrial use, we have a starting place. So with the drugs that are well characterized on Earth, that we've been able to give to hundreds, maybe thousands of people and do these kinds of measurements on, we see that some concentrations are below the therapeutic level. They're not high enough concentrations to actually be effective. Other concentrations are so high that they lead us to experience a lot of side effects. They're actually toxic. And in between is the therapeutic window, where there's enough of the drug circulating in the plasma to produce the desired effect, but not so much that very many people experience negative effects. So this is a very standard kind of experiment to do. And we have great modeling software to handle it as well. The physiological status of the body has a lot to do with absorption, the state of hydration, whether the stomach is full or empty, the fat content of the last meal. These we know play a big role in absorption. And they kind of lead us to think that spaceflight itself might also have an effect. And in fact, these experiments have been done previously, but on Earth. We have Earth-based evidence for the gravity dependence of absorption. A change in body position can affect the peak plasma concentration of a drug. Here's data from a study that looked at people who were ambulatory, standing up, walking around. Peak concentration significantly higher than it is for people who are bed rested or just lying down sleeping. It's also been shown that the time to peak plasma concentration can change significantly while you're lying down, depending on which side of your body you're lying on. We think this is because the positioning of the stomach contents over the pylorus can speed up gastric emptying when you're on one side versus the other. We also have some animal studies that have been done in space that indicate that metabolism of drugs in space might be changing a little bit. Cytochrome P450 enzymes metabolize most of the drugs that we take, and in a few different experiments, we've seen that the amount of cytochrome P450 drugs change in flight, or the gene expression associated with those enzymes have gone up or down. We haven't been able to measure this in people, though. So we don't know for sure at this point. But we do know for sure that there are medical complaints in space, and astronauts take medications in space. And I'm going to pick on one thing as an example for you today, looking at infections. Infections happen in space, and astronauts take medications for infections and skin rash. In fact, about a quarter of astronauts get rashes that are bad enough to treat. And some of these are persistent rashes that require trying multiple medications. So what would you use for a rash or a pesky little infection? You would use an antibiotic. So let's use an antibiotic as our model drug. And this is what I did with Dr. Cast. So we used amoxicillin, a broad spectrum antibiotic. It has a minimum inhibitory concentration against E. coli of 8 milligrams per liter. And you can see that here. These little filter paper discs have been loaded with the indicated concentrations of antibiotic. And there's a field of E. coli on this Petri dish. The lowest concentration of drug that kills the E. coli surrounding the filter paper is 8 milligrams per liter. We also know there's very good data indicating that in the case of this class of antibiotics, the time that the plasma concentration is above this minimum inhibitory concentration is the best predictor of efficacy of a particular antibiotic. So time over 8 milligrams per liter is what we're looking for in our treatments. And we can model this. This is from a simulation on Earth, healthy individuals. Time over the minimum inhibitory concentration is the best predictor for efficacy. We can also model this, and this was redone by Johannes. The blue line is the same one you just saw, with a time over MIC of almost 3 hours. Then we started playing with the physiological parameters that we think might change in space. The rate of clearance by the kidneys, or the volume of distribution, the amount of drug that leaves the plasma and gets sequestered into tissues. If we change these two parameters by not very much, just 30%, we can see, if we decrease them both 30%, that the time over minimum inhibitory concentration is now more than 5 hours. So this is likely in a scenario where a lot of people would experience side effects from this drug. If we change those same two parameters by the same amount, but in the other direction, so the kidneys would be clearing the drug faster and be getting sequestered into tissues faster, we see that the effective concentration, shown by this line, is never reached. So in this case, the drug would not be effective at all. Very dangerous situations, both of them, with not very large changes. We were actually really surprised when we saw this in the modeling. So we know that the spaceflight environment could significantly impact safety and efficacy of drugs in a couple of different ways. An obvious one that may have come up already in these symposiums would be stability or shelf life. But this is another aspect where changes in the human being could alter how well the drugs work or don't work. Right now, it's not clear if or to what degree the dosing regimens used during spaceflight are actually appropriate, whether they will actually guarantee safety and efficacy of the drugs that we administer. We think that changes in these PK parameters could be associated with increased adverse events or alternatively therapeutic failures, both equally bad outcomes. And these are kinds of things that could threaten crew health and missions as well, which is particularly problematic in the case of exploration missions where return to Earth might not be possible. So we need to know more about this. And I think that it's easy to neglect some of the first principles that we work with in science. We've given antibiotics and other drugs to lots of astronauts before, but we've been doing it without the fundamental information to know that we're doing it the best way. And I'd like to urge you to consider that going forward as we're actually preparing for long duration missions, for maybe starting settlements on other planetary bodies. Don't we owe it to our explorers to actually know these things before they leave, so we can know that we have the best prescribing practices ready to go for them if they need it? I thank you very much for your attention, and I look forward to the other talks in this session.